what is the role of the pharmacist in transitions of care for anticoagulation?
I think transitions of care is obviously a very important component of healthcare. We all know that patients get admitted to the hospital and they get new medications started, they have old medications stopped, and all of these changes are happening at a time when they're not at their best, when they're acutely ill, to be able to understand all of those changes, even if they're effectively communicated to the patient while they're in the hospital. So having a team of people, including a pharmacist, that can take those plans from the hospital and then translate them into action when the patient gets back in their home environment is critical to success. And so some of the things that we have done have been to develop a transitions of care model that includes pharmacists, nurses, physicians, and actually pharmacy students as well. We really incorporate our pharmacy students into this model to ensure that as patients are transitioning from hospital to home, that the plan is implemented correctly, that they have everything that they need, that they understand the plan. And again, getting back to your question about adherence, that there's not barriers to adherence or cost that we haven't thought about in the hospital, and that they also make all of their appointments that they need. So specifically to your question about anticoagulation, we have some automated systems in place where patients who are in our hospital system will transition to the pharmacist for management of anticoagulation, perhaps before they even see their physician, in order to get that plan implemented and to ensure safety of the use of anticoagulants. And so a lot of those things are just systems, that have been developed behind the scenes that occur because of great team members in our health system who make that happen without having to rely on the physician to do a referral, and are part of our population health management strategies within our PCMH and our ACO to make those things happen. And so if we don't have those systems in place, then patients can go home on anticoagulation therapy, get home, not be able to afford it, and so they don't get it, and then they're back in the hospital with more clots or worsening conditions. Or they go home and there's no appropriate follow-up for warfarin management, and so they end up having their enoxaparin fall off their list, and again, that puts them back in the hospital, or they go home with bleeding. And so it's really about safety in terms of making sure that patients transition home safely with medications that can cause harm. And pharmacists have a great role in that.